We're creating this tape to be more efficient in the office, and this will give you an opportunity for me, or give me an opportunity to explain to you what will happen with your surgical procedure. We're planning to do a total shoulder replacement. There's a variety of conditions under which a patient may require a total shoulder replacement. The most common would be to treat degenerative arthritis of the shoulder. There are other arthritic conditions in the shoulder that might require a shoulder replacement procedure. In your case, we'll be doing hopefully a total shoulder replacement. In some instances, a total shoulder replacement is not possible, and we can only do a partial shoulder replacement. And whether we'll be doing a total shoulder replacement or a partial shoulder replacement in your specific case, that will depend on the results of the workup we'll be pursuing, which will include an MRI scan and a CAT scan of your shoulder. Those specific x-rays are required to better determine the extent of your problem and to determine which operation is more appropriate for you. The reason a shoulder replacement, whether it's a total or a partial replacement, is done is to relieve pain and improve function, and that's what we're hoping to accomplish in your case. So a shoulder is a ball and socket joint, and this is a model of a shoulder, the bony anatomy of the shoulder, and what the prosthesis actually looks like. The ball is on the arm side. This is your upper arm, your humerus, and this rounded structure here you can see is the ball which we'll be replacing. The socket is actually part of your shoulder blade, which is this structure here, and this part of the shoulder blade is this small semicircular structure is actually the socket. And in your case, whether we'll be replacing both the ball and the socket or just the ball itself will depend significantly on the x-rays which will be taken in the evaluation of you over the next few weeks. The replacement itself consists of a stem, as you can see here, in this circular ball that attaches to the stem. This is then inserted into your humerus in this fashion here, and as you can see, this rounded structure here can be shaped to your anatomy, and this basically replaces the surface that is worn out, which is the ball side. And this structure over here, which is the shoulder blade, this is the socket, which we smooth down, and then we insert this plastic piece here into the socket, creating that articulation. And this side is plastic, the socket is plastic, the ball is metal. This creates a new articulation, which will significantly improve your function and significantly reduce your pain. If in the situation there's insufficient bone on your socket side where we can't insert the plastic, we will be replacing the ball. We will be reshaping what's left of your socket, and the ball will now articulate directly against your native socket without a piece of plastic interposed. As far as the surgery itself is concerned, I just want to explain what transpires in the hospital and afterwards, and what the risks of the procedure are. Typically for a shoulder replacement, whether it's a partial or a complete, you would be in the hospital, you would come into the hospital the day of the surgery, and in all likelihood go home the following day. Generally there's no need to stay longer, and there's generally no need to go to a rehab facility. Your arm would be in a sling upon discharge, and arrangements will be made for you to be seen back in our office approximately 1 week following your surgical procedure, at which time we would then start your physical therapy. The surgery itself takes between 2 and 3 hours. There is a fair amount of pain afterwards, which will be controlled through the appropriate medications. The therapy following your surgical procedure will start generally 1 week after the surgery, and exactly what will be required in therapy will depend on what happens during the surgery itself. Now the surgery is a relatively straightforward procedure. It does have a certain degree of technical difficulty. There are a certain number of risks involved with the surgery. The risk of any particular thing that would be considered a complication happening is very small. Generally, the complication rate following surgery of this nature is less than 1% for any one particular type of complication. And statistically, 95% of people that have shoulder replacement surgery are very pleased with the result. If in your particular case a complete shoulder replacement is not possible and only a partial replacement can be done, the results are still very good. However, statistically, there's a slightly greater chance of having some residual discomfort and a smaller or a slightly greater chance that the improvement in the function afterwards may not be quite as good. Having said that, probably between 80 and 85% of the patients that have just partial shoulder replacements also are very happy and do very well. The risks of the surgical procedure, and as I've already stated, the risk of anything bad happening is extremely small, would include the risk of infection after surgery, the risk of developing stiffness in the joint after surgery. Those are probably the two most significant risks associated with the procedure itself. There are a number of things that would have to happen if either of those complications occurred, which many times with an infection would require further surgery, possible removal of the implant. But the risk of that particular complication occurring is probably well under 1%. Some patients do develop stiffness after the surgery, which then makes the rehabilitation more difficult and the outcome more unpredictable, but again, the risk of that happening is small. The types of complications that can occur actually during the performance of the surgery would include during the insertion of the prosthesis and the preparing of the bone for the insertion of the prosthesis. There can be fractures sustained to the bone, damage done to the tissues around the joint, including the nerves and the vessels. Again, the risk of any of that happening is extremely small. We take extra care to ensure that doesn't happen, but in any one particular case or under certain circumstances, that can potentially happen. Things that can happen that would be considered complications following the surgical procedure that can occur during the course of your rehabilitation would be, as things progress along, it's possible to develop tears in the muscles about the shoulder as your function improves, your rotator cuff structures about the shoulder, because they haven't been used in a while due to your pre-surgical condition, will be stressed, and some people do encounter difficulties with rotator cuff strength, rotator cuff tears, and things of this nature. Again, this is a very low occurrence in terms of frequency of when it happens, but when it does happen, it creates a problem and makes the recovery more unpredictable. I think at this point, that pretty much informs you what can be expected and what can happen prior to the surgery, during the surgery, and after the surgery. It generally takes most patients somewhere between 6 and 12 weeks to reach a point where they're happy with the result. The duration of time which you'll need to participate with a therapist following your surgery will depend on your specific progress, but again, it's somewhere between that 6 and 12 week range. Once you've achieved adequate progress, we have you do the therapy on your own, and you will continue to see improvement with your function and so forth for probably up until 1 year after the procedure is completed. Statistically, as I said, 95% of people that have the total replacement done are extremely satisfied, and probably 85% of people that have the partial done are extremely satisfied. So once you've completed viewing this tape, we will then meet again, and you'll have an opportunity to ask more questions, and we'll further discuss what will take place next.